We're very excited to be speaking with you on this important topic today. My name is Becky Brocker, and I'm the Air Transit Portfolio Lead with Haggerty Consulting. We're an emergency management consulting firm that provides services to public and private sector clients throughout the nation on emergency management response, recovery, preparedness. And we're so grateful to have had the opportunity to work with both Los Angeles World Airports and the Chicago Department of Aviation on their efforts in the air transit space. So without further ado, I would love to turn it over to Tamara Mahal to introduce herself.
Thank you, Becky. Hi, everyone. I am Tamara. I am the Assistant Commissioner for Resilience here at the Chicago Department of Aviation. I am currently responsible for emergency management, safety, and risk management for both O'Hare and Midway International Airport.
And Justin?
Good afternoon, everyone. My name is Justin Pierce. I'm the Director of Emergency Management at Los Angeles World Airports. This includes LAX and Van Nuys General Aviation Airport.
Thank you both. So before we get started with the content of our presentation, I just had a few administrative remarks. First of all, I just wanted to make sure everyone is aware that you may submit questions to our speakers via the Hub portal or the YouTube stream, and we'll incorporate those into the discussion. We really would love to see this to be a very interactive session. And I also wanted to let you know that our slides will also be posted in the Hub portal. So should you need to revisit any of the content of the slides, you're welcome to do so there. And so I would love to just go ahead and transition into our presentation for today. So I plan on having this as being a talk show style presentation where I'll pose questions to Justin and Tamara and they'll address them from their perspectives. But just for those of you who may not be as familiar with the aviation sector, it's been quite an interesting period of time recently here in the last several months, really since January. LAX and CDA have both been handling a lot of different challenges in terms of resilience when it comes to COVID-19. And again, just to kind of set the stage for our conversation, according to the Bureau of Transportation Statistics, in 2019, U.S. airports and foreign airlines serving the U.S. carried an all-time record of 1.1 billion passengers per year. And that was even higher than the 2018 numbers. And LAX and Chicago O'Hare were two of the busiest airports in the world. And so then, in mid-January 2020, we saw, COVID-19 coming on the scene here domestically in the US. And the Centers for Disease Control and Prevention announced that 11 airports would be screening for COVID-19. And those included both LAX and Chicago O'Hare. So in the weeks to follow, our emergency managers and their teams here kind of rushed to put together those plans, make sure that all of those things could be implemented. And they had to react very rapidly to various international travel restrictions, safer at home orders throughout the US. And as a result of all of that, air travel really came to quite a grounding halt. There were a lot of impacts to their sector. And so basically overall in 2020, the Airports Council International is estimating that 4.6 billion fewer passengers are going to pass through airports. And that represents about at least a $97 billion reduction in revenue. So really our key question here is, how will the aviation industry survive? And of course, we understand that having a safe, secure, and resilient air transit system is really critical to reducing public health risk and also supporting the U.S. critical infrastructure as a whole. So really what we want to achieve from this conversation is just underscoring the point that government and private sector partners really need to work together to reduce the risk so that we can restore confidence to passengers, as well as airport employees, concessionaires, service providers, and airlines, of course, who are all of our partners in air travel. So these two airports are really helping to lead the charge by implementing new policies, leveraging technology and evaluating existing technologies that can be applied in this setting, and rethinking resilience during the largest pandemic that we've seen in over 100 years. So again, we're looking forward to learning from their successes, challenges, and lessons learned today. So I'll go ahead and start off with one of our first questions here. So we want to discuss the initial response to really the COVID-19 situation at your airports. Tamara, the first question is for you. What policies and plans did O'Hare have in place to guide the response to COVID-19? And to what extent did both O'Hare and Midway have to adopt their plans to meet the specific needs of COVID-19?
Yeah, great question. I'd say that we had several plans and policies in place. But what's interesting about the airport is that we are hands down the most complex operating environment on Earth. Airports in general are kind of like an onion in terms of the different partners that are coming together to work on different parts of keeping an airport up and running, and certainly servicing our airplanes and serving our passengers. So I'd say when we think about the kinds of plans that were in place prior to this happening, we can't just think about the Chicago Department of Aviation, but also our city partners as well as our federal partners. CDA does maintain an emergency operations plan for both Midway Airport and O'Hare Airport. We do include a public health annex in there that really provides the foundational basis for how partners will come together to coordinate and communicate in the event that we do have some sort of public health emergency that requires a response. But we also rely heavily on the City of Chicago's Department of Public Health. We have a very close relationship with them. At our airport, our public health partners are badged and ready to respond, and they even have their own plans for how they will support the airport should we have a public health emergency. And then I'd say the other plan that I think is incredibly critical when we talk about these issues, especially for O'Hare being an international airport that serves quite a number of countries, is the CDC's Communicable Disease Response Plan, which was developed for O'Hare and really actually guides a lot of the international, even and to a certain extent, domestic travel response in terms of public health emergencies. Interestingly enough, I'd say probably the plan that played the most critical role, especially in the initial response phase at O'Hare, was our Ebola response plan. Because back in 2014, when certain airports were selected for screening activities for Ebola, the city of Chicago developed a pretty comprehensive Ebola response plan. And COVID-19 didn't start here at O'Hare as a pandemic that was impacting the city of Chicago. Of course, it started with the implications of a pneumonia-like virus coming from China and needing to implement screening. So I would say that plan combined with the other plans that we have really helped guide the initial response. But of course, when we started looking at what we were dealing with this novel coronavirus, we immediately identified that the impacts both locally in terms of our ability to carry out a pretty extensive screening operation that was changing rapidly, as well as towards the end of February when we saw that there was a potential that the pandemic could hit us domestically. And of course, Chicago had the second confirmed case in the country that was related, and it was related to travel. We identified we really needed to adopt that plan. And so what we did was develop at the time was called novel coronavirus, is now called the COVID-19 concept of operations, which really takes all of those plans and brings them together into a framework that allowed us to effectively coordinate throughout the duration of this, focusing on a few key areas such as sanitization, communications and marketing, our screening process, handling our own internal employee support, as well as the support of other badged employees, and of course, the provision of personal protective equipment where applicable.
Great, thank you so much, Tamara. So to kind of build on that, what Tamara had spoken to, Justin, so it kind of seemed, at least from my perspective, that every day we were hearing, and we continue to hear new information and getting more studies on COVID-19 and understanding the virus more. So as you, I guess thinking back when you first learned of the virus and you were continuing to learn more, what were your top concerns and how did you address them?
Yeah, it was scary with all of the new information that was coming in. There was a lot of unknowns, which made the COVID virus very, very unpredictable. Our top concerns were obviously our passengers and our employees and badge holders and their safety, particularly those who fell into the high risk categories. Second, it was very early on. It was clear that this was going to be a prolonged incident. And so the concerns from an emergency manager's perspective, we started to discuss how we were going to respond to other emergency incidents or an aircraft disaster in this new environment? How were we going to establish a family assistance center? How were we going to activate our emergency operations center? The traditional models that we had been planning, training, and exercise on would not work in this new pandemic environment. So we really quickly had to come together to discuss how we would be able to continue those services while maintaining social distance and all the other precautions to prevent the spread of COVID. The third was, how do we continue airport operations? And I think we'll get into the impacts of COVID later on. But the third items that really jumped out of my mind was, how do we continue our airport operations having so many different impacts that affected us at both LAX and Van Nuys? One of the first things that we did is we sent home all of our at-risk employees. That was over 300 people who were able to go home. Some were able to telework, some were not. Some were not able to telework because just their job function required them to be in the field, and they couldn't do that anymore because they were in the high risk category. Others could telework, but we didn't have the equipment for those individuals to do so. So we quickly had to, on the spot, buy more computers, make sure all those individuals have VPNs and get them connected for those employees so they could continue to provide support to the airport and our operations. And in regards to the information and how it changed daily, we really tried to govern ourselves not to be reactive to the news of the day and take a holistic approach to looking at the threat, in which case this was COVID, understanding it, understanding what COVID was a threat to, and then how do we come up with very specific solutions to mitigate that threat to ultimately, again, protect our passengers and our badge holders.
Awesome. Thank you so much. So thinking about consequence management and the impacts of COVID-19, Justin, I know that passenger volume dropped dramatically to 95% less than the previous year at LAX. So can you talk to us a bit about those primary and secondary impacts to LAX that resulted from that development?
Well, I'm happy to report we're only down 70% now from where we were a year ago. So we're slowly climbing in the right direction. Hopefully that continues. So the joke that I got a lot from all of my peers was, well, you must be pretty bored as the emergency manager because you have no passengers right now. That was definitely not the case. I felt more busy, during those first weeks after COVID hit than, 6 months before. Our passenger volume was a lot higher. One of the big things that hit us fairly quickly, which was a shock to me, was the financial impacts to the airport. And when I say the airport, I mean our airlines, our concessionaires, our service providers, and we as the airport entity, we were hit financially as well. We had some concessionaires that were bringing in $12,000 to $13,000 a day in revenue, and it was now less than $500 a day, which is completely unheard of or even unimaginable. And so they were looking for us for financial relief. At the same time, we're cutting our costs because of the impacts to our financial budget. This has been an ongoing thing that we've had to try to mitigate, and it certainly has been widespread. I think the second one for cascading impacts is the impacts to our workforce. As I mentioned before, we sent home about 30% of our workforce because they fell into that high risk category. But we also had a number of employees who may have been exposed to someone who tested positive for COVID. So out of precaution and following guidance from our public health officials, those individuals were sent home for 14 days. So we lost additional staffing from our workforce. So there was a point where it was extremely difficult for us to cover all of our shifts to maintain compliance with FAA and other federal, state, and local regulations. And our operations team had to get very creative on how they staff to cover our airport operations so we can continue to operate.
Great, thank you so much. And we actually just received our first audience question, so thank you so much to whomever submitted that. Tamara, if you don't mind, I'll ask you to respond to this one first, if you're able. So this person commented that public sentiment towards U.S. airports has been mixed when evaluating the measures taken by U.S. airports versus international airports. So the question is, what role do airports as organizations take to determine the level of screening? The question says, but I would interpret that to mean the appropriate screening measures, or how specifically you do those processes at your airports.
It's a great question, and one that we get quite often at the airport. I think before I get to that specifically, what I'll remind our listeners is that, again, we are a very complex operating environment. We have many partners that come together to work simultaneously to kind of make sure that everything keeps up and running. And I think what's been really interesting internally at the airport is that each of these organizations is making up different policies and kind of has a different piece of the pie for the responsibility that they have. And most often the policy decisions that are coming from their headquarters, and they're just responsible for implementing them here at the local level. I think when we think about the areas that we really want to make sure that we can make passengers and our employees feel safe, we tend to focus on the terminal environment. And when you think about the different touch points that people have, you're coming curbside to get dropped off, you're going inside, you're going through the TSA security screening area, you may be going to concessions, you're waiting in your hold room, and then you get on a plane that's controlled by your airline. And you have a lot of these different policies and perspectives that are coming together. I think the airport as a whole has two primary responsibilities when it comes to trying to dictate how these things come out. I think the first is really looking to public health for best practice and guidance on what we can do to keep our passengers and our employees safe. Here in the city of Chicago, the guidance that we've received is there's certain things that we can do, like require face coverings. And what we have to do, I think that is the second most important thing, is work with our partners to make sure that there's a level of congruence when it comes to those policy decisions that are being made. So it's difficult, for example, this is just an example, if we said face coverings are required and another organization said, but our policy says that they're not, we have to work really hard with our partners to provide a consistent basis for that and determine based on what's going on locally, how we're going to implement that guidance and what that guidance may be. I think the other challenge there for airports, and one of the reasons why you don't see more consistency across the board in terms of the way that we approach these certain situations, is that we have both what's going on with the COVID-19 outbreak locally. For example, in Chicago, we're still doing very well. And then, of course, we have what's going on in other areas of the world and even in other parts of the United States when we combine all of these travelers. So it makes it very difficult to provide a consistent set of guidelines and rules across airports, that some of which are privately owned, some of which are publicly owned, like the ones that Justin and I work for. And so it does make it difficult. But overall, I'd say that there's been a lack of federal guidance that provides kind of a consistent approach across, and we're all just doing our best to work with our local health departments to make sure that we can provide that consistent approach back to the passengers and the employees.
Thanks so much, Tamara. Justin, did you have anything to add to what Tamara had said in response to that question?
You know, looking back, like Chicago, initially we wanted to wait for guidance on what to do and how to respond and how to keep everyone safe from our public health officials, from our federal partners. And, you know, the reality is no one exactly knew what to do. And we started to wait, and then we started to wait some more. And then once the guidance and direction came down, as Tamara said, that some of it was conflicting, And so at one point, we decided just to be more proactive and just take a common sense approach to implementing, signage about keeping socially distant and wearing masks, and increased our level of hand washing, sanitizing machines throughout the airport. The little things that we thought we could do, regardless of the direction that we got from our partners or from public health officials, would help make a difference. And so looking back now, I think if I could change one thing, I would have acted even faster and anticipated the guidance being a little slow coming down to airports, and just jumped in and started to do proactive things. And we can always pull back. It's easier to pull back than having to speed up and catch up to new policy and guidance.
Thanks, Justin. And I think that conversation weaves really nicely into what the next question I was about to go to previously. So Justin, can you talk to us more broadly about that operational coordination component that I think both you and Tamara have touched on, really thinking about how coordination looks, what it looks like and how it works between airport, city, county, federal, private sector partners, to include the challenges that you experience as well as the successes in that arena?
Sure. I'll go back to, emergency management's, core responsibilities, and that's maintaining relationships and bringing people to the table. It's the power to convene. I think the key to a successful emergency manager or business continuity personnel is having a network wealth. And what I mean by that is having the ability to reach out to your key partners and bring them to the table when you need them. And in this case, it was to solve problems. Throughout this incident, I've followed the 3x5 rule. The 3x5 rule goes like this. Every day I would call 5 people, I would text 5 people, and I would email 5 people within our operations. And the whole purpose of that was to say, how are you doing? What are you seeing? And what do you need? And for every one problem I was able to help out with a partner agency, I felt like in return, in the future, they were able to solve 3 of my problems. And I would do this every single day to have those touch points with our partners. So when we needed them to bring them to the table to help us with our screening operation, it really expedited that process because they kind of already understood what was happening at our airports, what our challenges were, and knew how to plug into our apparatus to solve our problems.
Thank you so much. So Tamara, thinking about business continuity from the perspective of Chicago O'Hare specifically, so what business continuity solutions did you all have to implement to ensure the airport could continue to operate?
Yeah, that's an interesting question for us because I think, we essentially have 2 different parts, right? So we have the operational side of things, which is very hands-on and has to continue to operate to make sure the ground handling happens, the facilities are taken care of, the dispatching still happening, we're able to secure the airport. And then you have the administrative functions. I don't actually think we were that different in terms of having to implement business continuity than many other organizations that had administrative personnel that were going to be sent home in order to limit their exposure. Yes, we had to implement continuity of operations plans. We had to ensure, Justin brought this up, do we even have the technology to support the number of people that have to go home and work from home? We have become experts on virtual meetings and screen sharing. But I think that practically on the operational side, there were several things that we had to do to ensure that we could limit the exposures of our operational employees and ensure that they could come to work. I think this is no surprise, but it doesn't matter if you're an airport employee or someone else. the things that were impacting the rest of the economy were also impacting our own employees. So when schools closed down, we had a lot of employees that had difficulty, especially in the first couple of weeks, trying to find childcare. So we worked with the city of Chicago, and they provided access to Sitter City, which is a website here in Chicago, to connect families of essential workers that worked for the city and also for the airport with childcare solutions. We also had to kind of change the way that we think about how people team up and operate. Because one of our main concerns was we have several specialized positions here. They work very closely in teams, and they're not something we can easily replace by going to a temp agency or something else should they get sick or have to go home and take care of a family member. So we started looking at, well, how do we change schedules and how do we actually change the teams that people work in so that if one of them does come down with COVID, they're not exposing every person within that specialized title, to ensure that we could protect against the loss of a function as the result of COVID-19. And I think we have a couple of really good examples as to how that affected us, and I'll wait a little bit later to talk about those. But I think from that perspective, the airport kept operating because we kept people coming to work, not because we were sending folks home from the administrative side. And I think, we're talking a lot about resiliency. A lot of what we learned from the business continuity standpoint is that resiliency starts at home. And what kind of solutions are we going to implement, not just to support our employees to get them to work or to make sure they can carry out their essential functions while they're at home, but also so that home is taken care of so that they can come to work and ensure we can continue our essential functions. So I think there were a lot of different solutions that we had to implement that mirror what a lot of other folks had to do, but also bring in the complications of having an on-site need for personnel to be here and maintain an active presence at the airport.
That's interesting. One of the things that we were asked to do very early on from the mayor's office and from the City Department of Emergency Management was to update our continuity of operations plan and make it specific for COVID. And going through that process, there was these assumptions that a majority of our staff were not essential. And we got into this debate, as I'm sure many of your organizations have, of what employees are essential and what employees are not. And the assumptions that we made historically of putting together our continuity of operations plan were completely not true. It turns out a majority of our organization, if not entire organization, were essential employees. We need our custodial staff. We need our gardeners. We need our electricians. We need our airport operations folks. We need our bus drivers. If anything, it's the back office staff that we were able to minimize the impacts if they were, for whatever reason, unable to perform their job. But looking back now, one of the takeaways, at least from my perspective, of all the years and of all the training courses and certifications on business continuity and continuity of operations, is that 3% rule, that 3% of your organization is essential and continue it. That's just not true. At least that's what we found out here and what I experienced. It's probably only 3% that are not essential and that you can really operate the airport without. And in fact, those are probably the executives of the airport, which the airport could probably continue, if they didn't show up for a couple of days.
Yeah, and I would echo that, and I would say, just to give you an example, so there's 45,000 badged employees at O'Hare Airport, but CDA only employs about 1,600 of those. Of all of the 1,600 employees, only 130 something were eligible for teleworking because everyone else is an operational person that needs to report to work. And when we were going through and looking at this from the business continuity perspective of essential functions, and I actually have a really funny spreadsheet because it shows the ones that we could cut in kind of a tier 4 situation. And it was like special events, and that's about it, because everything that we do here is essential. And the other thing I'd say, I think one of the challenges from the business continuity perspective, and certainly identifying solutions, was that, we're not an office building where everyone has the same work environment. we have folks in towers. We have folks that are just vehicle services. We have folks that work on the airfield. We have folks that work in our heating and regulation plant. So you had all these different environments, and we had to figure out how to to ensure they could safely come to work, which meant different precautions and different issues for every single work location. And that level of complication, because of the different types of work, we really are our own city. That really challenged us, pushed us to the brink of thinking about business continuity. And to Justin's point, and I'll take this on us, we were very prepared for a facility loss or an IT disruption. We were not as prepared for this kind of pandemic scenario in terms of our own employee safety. And I think, it really pushed us to the brink in looking at a lot of those issues, because we are point blank an essential organization. It's not about essential employees. It's about an essential organization that carries out these functions, for not just for ourselves, but for critical supplies. And a lot of people have focused on the loss of passengers, but have forgotten that airports are the reason that we've been able to respond to this pandemic.
Absolutely, all great points. And I think that really underscores the importance of, I think a lot of companies and both public and private sector organizations really are now looking and revisiting their COOP plans and thinking about, okay, well, a lot of assumptions previously were that, like you had said, looking at an IT disruption or a physical location issue, right? So thinking about making sure all the technologies are in place to enable virtual work has definitely been a challenge. I think that's one that we'll continue to work through as a country. So really, really loved the back and forth on that one. So I'm curious, are there any other key on-the-spot solutions that you all came up with, Justin, at LAX, that you could share? I know you had a lot of innovative things going on there, as did Chicago, but just curious if you could share a couple of those on-the-spot solutions you developed.
As much planning as Los Angeles World Airports have done in the past 5 years, there were still so many on-the-spot solutions we had to create because they were so unique to our response to COVID. I've only been with the airport since September of 2019, so I guess it was fitting. Once a new emergency manager comes on, you need a major disaster. And that was the case here. And since I started, the conversations were all, how do we make LAX as big as possible in our small little footprint? And then literally overnight, the conversation changed to how do we make LAX as small as possible because of the financial impacts and the loss of staffing. So we had to shrink the airport. So we were focusing on closing down parking lots and limiting busing routes, shutting down terminals, to make our operations more efficient to support our passengers. The second solution we had to create on the spot was initially for COVID reporting and contact tracing. And as we discussed, an airport is a very complex environment. We needed to create a single solution for our employees, for our federal partners, for our concessionaires, our service providers, our airlines, to how we were going to report COVID cases, and then how we were going to conduct contact tracing to send those individuals home who may have been exposed. Obviously, our county and state health officials were completely overwhelmed initially because of just the vast scope of this incident. And so we took it upon ourselves to protect all of our badge holders and had to come up with a streamlined process to do so. Another on-spot solution we had to come up with was disaster logistics and resource management. LAWA, we buy a lot of stuff every single day. And that's done from a decentralized process. So every division and group within our organization more or less procures their own supplies, including PPE, cleaning supplies, face coverings, things to that nature. And what we found initially is all of our divisions and groups were actually competing with themselves, contacting a single vendor by 4 or 5 of our divisions asking for the same supplies. And so what we had to do is really establish a true logistics team to coordinate and streamline that process. So one, we were not competing with ourselves, and two, we were maximizing our limited resources to as quickly as possible get the equipment and supplies that we needed in order to protect our employees and our passengers.
Great, thank you so much. So Tamara, was hoping you could share some of the lessons learned in the city of Chicago while you were simultaneously responding to COVID-19 and the civil unrest that occurred in the city and surrounding communities last month.
Yeah. For context, I think for those that are not as familiar with Chicago, the Chicago Department of Aviation oversees both O'Hare and Midway airports. O'Hare is the busiest airport in the world based on aircraft operations. And so we often think of Midway as the little brother, but actually Midway is the 26th busiest airport in the United States. So it alone carries 22 million passengers in a normal year. And O'Hare is kind of set off in the northwest suburbs almost, even though it's considered part of the city. But Midway actually is quite literally in the very urban environment of the city. So with the death of George Floyd and the resulting unrest and protests that took place in Chicago, although O'Hare was a little bit immune from it, Midway certainly was not. And we saw several protests that occurred literally on the corners of the airport while we were still very much in the height of thinking about and looking at our COVID response. And I think that there were several challenges. I didn't talk about this earlier, but I think one of the things that we have to keep in mind is that this is historically the longest response operation that's ever gone on in the United States at this level. And certainly for the Chicago Department of Aviation in the city of Chicago. By the time that this civil unrest period had hit, our team had been working on COVID for 4 months straight. And the city of Chicago's Office of Emergency Management had also been working on COVID response for 3 months. And so we had what I would say was an understandable level of tunnel vision going on, where we were so focused on COVID that we weren't as focused on looking at what was going on in our ability to respond to other things that I think Justin maybe did a little bit better of a job than we did here in Chicago. So I think that was the first challenge, was kind of waking up a little bit from COVID and reminding ourselves that that these other incidents were still ongoing, and we had to make sure that we could coordinate and respond to them. I think the other thing is just that COVID itself presents a number of challenges in the way that we traditionally operate during an incident. Normally we gather in an emergency operations center. Our seats are right next to each other. We put 50 people into a not that big of a room in order to effectively coordinate and share information. And fortunately, we had at that point in time really thought through how we would socially distance and what that would look like in our EOC. But that meant that we had both physical connection going on with people in the room, but also a lot of virtual information sharing going on during an ever-evolving situation with these incidents. So we were actively adapting and trying to change the way that we coordinate and communicate during a pandemic, during civil unrest that was impacting the airports. I think the other thing was that we, of course, had first responders out there that were working very closely with the protesters and that were monitoring the protests there. So ensuring that they had the appropriate level of PPE and understood what precautions to take, and working with public health to determine how that would then impact quarantine periods after that and what that might look like, was another challenge that we wouldn't have typically had to work through and handle as a result of that. And then I think another thing was just the constant communications in terms of our external communications about concerns from passengers and employees I'll say it created in some ways another continuity situation for us when we had employees from impacted areas that couldn't safely get to work. The CTA, our Chicago Transit Authority, had to be shut down, moving from the south side to the north side in the city. And that really impacted the ability of employees to actually get to work. So while we were already in this kind of weird continuity situation, we then had to move forward and kind of be thinking about another type of continuity, which is how do we ensure that our employees can come safely to the airport that need to be here to operate when we had so much activity going on in the city and public transit was so tremendously impacted by it. Not to mention the impact of that public transit on the few passengers that were trying to get to the airport. And so we had kind of all these influences coming together, and it made for what I would say was an extremely complex response, but one that was carried out very efficiently thanks to the professionalism of our airport responders and certainly our team members here at the airport.
Thank you, Tamara. And we just got a question from the audience. The question reads, can either airport talk about employee diversity and how that impacts their response to BLM, et cetera?
I can take this one. Obviously this movement that's happening right now is affecting us all, and everyone, all organizations, governments are kind of rethinking on how they look at diversity, and we're no different here at Los Angeles World Airports. Our CEO quickly established a diversity task force with folks from at all levels of our organization who were interested in volunteering and in examining diversity at Los Angeles World Airports and what we can get better at. That group just met, I think, for the first time last week. And I'm looking forward to the recommendations and the improvements we make to make our organization more diverse in the future.
Thank you, Justin.
I think, I think to echo Justin's point, we're part of the city of Chicago, and Mayor Lightfoot certainly has a dedication to a more equitable approach to things here in the city. I think from the airport's perspective, we have always had a consistent focus on ensuring that we have a diverse workforce that's representative of the city. And I think that one of the interesting things about working at an airport, especially as an emergency manager, is that we're often thinking about all the different types of passengers and employees that are coming through, whether that means that they have a disability or they speak another language, or they have other factors that contribute to their reactions and response. And I think as a result, we're well suited to kind of look at that from a diversity lens. But I think that this has been a really critical time, especially in the city of Chicago, and especially during this period of civil unrest and what has followed, to ask ourselves, how could we be better? And, what I can say from the perspective of resiliency here is that diversity is incredibly important in resiliency. You can't be a resilient organization if you are not addressing the individual factors of all the individuals that work for you, as well as those that are traveling here, and passengers that certainly serve and come through the airport. So I think that's just a tenet value that we try to respect.
Great, thank you both so much. So shifting our focus now, with the remaining time, I'd love if we can think about recovery and building resilient airports and continuing to have that emphasis. So Tamara, if you don't mind starting us off here, from this experience, what has Chicago O'Hare learned about resiliency?
A lot, quite frankly. I have a bevy of responsibility here, all of which surrounds this idea of how do we analyze risk and how do we mitigate against risk. And I think one of the things that's been most challenging for COVID-19 with all of us has just been this kind of ever evolving change of what COVID is and how it spread and how we protect against it, as Justin had talked about. I think one of the things that I look at a lot is from the financial risk management perspective. It's very interesting to go back and look at the impact of SARS on the aviation industry, especially for Asian countries, or the impact of Zika, especially for South American and Central American agencies on the aviation industry, or even the impacts of Ebola. And not question how it is that we got to this point and how we weren't more prepared. So those are a lot of the questions we're asking ourselves now in terms of what does the future look like? How can we build more resilient frameworks for financial management, for operational management, to ensure that we're better prepared for this? I think one of the other things that we've learned is that even the way that we design our airport, we need to be prepared for the eventuality that we're going to get hit by a disaster. For a long time, we've been building windows here in Chicago that are high wind resistant. And now as we go and we look at, we're building out this massive O'Hare Global Terminal, we're already talking to the consultants that are helping us to design this from the resiliency side of things to say, how do we build a pandemic resilient airport that allows people not to be screened, but to socially distance? So much of the way that airports are designed forces people into small spaces together. How do we rethink that? How do we rethink security screening lines? How do we rethink cold rooms and the way that people sit together? How do we rethink concessions to ensure that we can provide an airport that's not just pandemic resilient, but also flu resilient every fall? And how can we learn from this to impact the things that we see on a much more consistent basis? And then I think the third thing, especially personally as an emergency manager, I've been fortunate to be a part of a lot of disaster response and recovery in my career, but certainly never to the level of a sustained response like this. And I think what we've seen is that we don't just need to be thinking about how our facilities, how our finances can be resilient, but we need to be thinking about how we build resilient employees. And I really believe that actually starts with how do we take care of them at home and how do we support them. This has been a threatening disease, especially, for my employees, it's from the safety side. For the employees that are medically vulnerable themselves, or especially for our employees who are not, but have a medically vulnerable person at home that they love and care about, the fear of coming to work and not feeling like they were safe, or not even knowing what to do outside of work was really powerful. And so I think one of the things we've done in terms of our education campaigns, we've kind of transitioned away from just saying how to be safe at work, but also how are you safe out in the community at home? How can we help educate around those issues so that people feel more comfortable in general? That not only helps make us more resilient as a workplace by keeping these types of public health disease or infectious diseases away, but also ensures that our employees feel comfortable leaving their home to come to work. And so I think there's a variety of factors there where we kind of learned in general about those resiliency factors. And I think those are probably the most critical areas that we're going to look to improve on, certainly not just for pandemics, but for the variety of threats that airports face.
Thank you. And as a follow-up on that question, I was curious, you had mentioned safety of the employees of CDA. Could you just expand upon that just a little bit, as I think that will be really applicable to potentially to other businesses or other types of workplaces. Could you speak a little bit more to what you all are doing to make the airport a safer place for your workforce?
Yeah, so I'll just start by saying you already heard me say that we have 45,000 badged employees at O'Hare and 5,000 at Midway, but only 1,650 of those total are CDA. So here's the first thing. I think in terms of what we've done to keep our employees safe, of course, we distribute PPE. We consistently provide updates on what they need to be looking at. We're working right now on actually designing an internal website that people can go to answer their questions. Hagerty has been engaged here at the Chicago Department of Aviation, has been very helpful in assessing our facilities and also helping us to write a preparedness guide to help guide our employees on what they should be doing. But one of the things that we also think is really critical, and this is where I transition a little bit from my CDA employee safety hat to my emergency management hat, is how do we help everyone else ensure that their employees are safe? Is it in the distribution of PPE and hand sanitizer? And do we support cleaning services? And the answer to those things is yes, from our perspective. But I also think the number one tool in ensuring that your employees are safe during a pandemic is communications. Are we putting out graphics and materials that our partners can use with their own employees to keep them safe? Are we all on the same page as to what contact tracing looks like? Especially in the beginning, so many organizations would call us and look for guidance as to what to do if one of their employees had tested positive for COVID, because we have this wonderful gift that they don't have, a direct connection to a public health official. And so what we did was provide a lot of support to our employers so that they could provide support to their own employees, so that we were viewing this from a holistic standpoint of saying every badged employee here matters and every badged employee's safety is critical to the operation of this airport, instead of just staying focused on the city of Chicago. So whatever we did, we communicated out, we provided the resources to ensure that there's consistency going on across that basis. And I think from that employee standpoint, we've been as successful as we could be given the level of changing guidance that has gone on.
Thank you so much. Shifting the spotlight back to Justin for a moment. Justin, could you talk to us a little bit about what recovery looks like at LAX? And then thinking back on the response to date, do you think that there's anything that LAX could have done better to prepare for COVID-19?
I think the old saying goes in emergency management, as soon as the ground shakes, recovery starts. I didn't see that for this one. It took us a little while to get our hands around the response, to understand what the impacts were, and to craft mitigation strategies based upon those impacts. It was probably around March or so when we really started to kind of get our feet settled in with what the new operating environment was going to look like and feel like as a result of COVID. And we got into that rhythm where we sort of were able to take a step back now and regroup, and now focus on what recovery looks like 6 months from now, a year from now, 18 months from now. We established various work streams, looking at all aspects of recovery, from when and how we would bring our workforce back, how we would bring and our passengers back by instilling confidence in them that it is safe to travel, and that we were doing everything we possibly could at the airport to make their experience from the curb to the gate as safe as possible. We wanted to take advantage of the situation with the reduction of passengers. We have the ability to help expedite some of our major capital improvement projects. So we're trying to rapidly get our automated people mover and our rental car center and all the other major big construction projects completed as fast as possible, because we don't have as much traffic and congestion and passengers as we normally do. And we looked at, how can we engage and communicate with our stakeholders more effectively? And we were just previously talking about this, and informing them and giving them the information that they need to make better informed decisions. We started to examine what are those recovery indicators? Like, how do we know things are improving, so we can know how to influence those things? So we created recovery key performance indicators. We loaded those into a Power BI dashboard for us to use and to analyze to help inform our decision making. And Becky, yes, perfect. I was just going to say, I think we have a screenshot. So this is an example of the dashboard that we created with all these different indicators of information, looking at passenger counts from a given moment to a year ago. And so we could actually progressively see our improvements in certain areas. We also partnered with Pepperdine University and the Homeland Security Council. They have a great tool called Solace. I think we also have a screenshot of this. Yes, right here. So this is a dashboard we created, which helps us monitor the CBP's and CDC's screening operation at LAX. It also accounts, and this is where we put all of the data for all of our badge holders who have tested positive to COVID and where they were working at the time when they tested positive. So we can sort of see trends and a visual representation of where we're seeing clusters of positive cases. So we can increase cleaning in that area. We can push out messaging. We can ensure that people are being socially distant. These are some of the tools we use that really armed us with information to help our decision making when it comes to policies, plans, and then procedures.
Thank you so much, Justin. And to add to that, are you able to expand upon a little bit? I know you all have put a lot of measures in place and explored new technologies to make the airport safer for passengers. Could you speak to that just a little bit, please?
Sure. I think now is a great time for experimentation. There are lots of things that we're doing to try to make things better. You have a shot on the screen here of our terminal wellness program. We partnered with a few companies about a month ago, and we want to do thermal screening checks at our airport. While we recognize if a passenger or an employee has a temperature, that's not the only symptom of that, doesn't necessarily mean that individual has COVID, but maybe this is one additional data set that we can use to help inform those passengers to make people safer and feel more confident about the traveling experience. And so in Tom Bradley International Terminal, we started to pilot thermal scanning technology. Again, it's let's see how this works and see how we can use it. What are its strengths? What are its weaknesses? And will this ultimately help us achieve our goal? We also looked at all the different touch points that a passenger would experience from the moment they're dropped off at the curb to the moment they board their gate. I think there were like 87 different touch points right now. And we're trying to eliminate all of those. So the entire experience at our airport is touchless to help, again, keep our passengers and our employees safe. Everything from, touchless toilets to hand washing machines to ways to pay at our concessions, so you don't have to exchange cash or use cards, touchless pay. Everything in that process, we're looking at how do we reduce the touch points as a traveler is working through our airport.
Thank you so much, Justin. And I think we're right up against our final seconds here. Any closing burning thoughts from either you, Tamara, or Justin? I'll kick it to you first, Tamara.
I'll just say that this has certainly been a challenging time for the aviation sector, both in the perspective of continuity of operations for our own employees, our ability to keep up with revenues, and then of course, experiencing losses in our own community. And I think there's a lot we can learn from this, and I'm very proud to be part of both my local community as well as an airport emergency management community that is open to sharing what we are learning so that we can all improve and create not just more resilient Chicago airport, but a more resilient sector.
Thank you so much. And Justin, any closing thoughts?
We have to do a better job at preparing. I see it's such a reactionary industry where organizations, both government and private, only make progressive and actionable change after an incident. We have to move past that. So now I'm talking to all of the executives and financial folks that are listening, And it's whatever your budget is for emergency management and business continuity, triple it. I'm serious. You have to, the amount of investment that an organization puts up front to protecting themselves and preparing for these crazy situations, you're going to get that money back on the back end, because it's going to reduce the impacts to your organization and it's going to help you able to respond. So I hope that this is yet another wake-up call for all organizations to focus and pay more attention to emergency preparedness and building resiliency within their organization.
Great. Well, thank you so much, both of you, for your time, and to everyone who is watching and listening. We really appreciate your participation and your questions. Please feel free to reach out to us at any time with any questions you may have. We have our contact information here on the slide, and it's also available through the speaker portal within the Hub platform. So without further ado, we will go ahead and conclude this session. Thank you all so much for your time, and we look forward to hearing from you soon.
Thank you. This was fun. Hope all